Good morning, good afternoon, good evening. Welcome to all who've joined us from many parts of the world and many time zones. This is the second of two webinars that's being co-sponsored by the NGO Committee for Social Development. As we begin, I want to call your attention to the translation feature. Everyone should select the language, English or Spanish, that they wish to hear. There is an icon that should show up on the bottom of your screen with a globe, a picture of a globe. Click on that and select English or Spanish. That will allow you to receive translation when someone is speaking the alternative language. So give you just a second to try that. Hopefully that will work for everyone. And you will be able to hear all of our array of speakers today. As some of you hopefully saw, if you clicked in on time, this session is being recorded. So if that's a problem for any of you, you would need to leave the session. Again, welcome to everyone. My name is Lynn Healy. I am the main representative of the International Association for Schools of Social Work, and I'll be the moderator for today's event. We will have 4 programs that will be sharing grassroots perspectives on our topic on SDG10, and we certainly hope to have time for questions. If you have a question, there's a question and answer button on the bottom of your screen. Please type your question into the question box, and we will address those at the end of the session. This side event will feature grassroots perspectives on the impact of COVID-19 on progress toward SDG10 in communities in North and South America, Asia, and Europe. SDG10, Sustainable Development Goal 10, is to reduce inequality within and among countries. During the period leading up to the adoption of the 2030 Agenda, civil society organizations were very active during the negotiations for the SDGs in advocating for inclusion of Goal 10. Our organizations recognize that inequality is multidimensional and damaging to social cohesion. Therefore, it is important to emphasize inequality as well as poverty reduction. The speaker yesterday from the Food and Agriculture Association in our committee's webinar re-emphasized the urgency of addressing inequality. Numerous studies during the first 2 decades of the 21st century documented growing inequality. Sadly, as reported just recently in the April report of the Secretary General on progress toward the Sustainable Development Goals, he reported that the pandemic has made inequalities worse and reversed the already slow progress toward achieving Goal 10. The official report outlined growing disparities in income, education, employment, and of course, health impacts of the pandemic itself. Our event today is a follow-up to a pre-COVID-19 global survey done by the Grassroots Taskforce of the NGO Committee for Social Development. The panelists chosen for this side event all gave rich information on inequalities at that time, allowing us to have a unique before and after assessment. They will discuss the impact of COVID-19 in their communities and how the pandemic has affected the situation of inequalities. Before we hear from the Grassroots panel, Sister Veronica Brand will provide the pre-COVID-19 context by sharing a few key findings from our 2019 survey. Sister Veronica is the representative to the United Nations for the Religious of the Sacred Heart of Mary. She had extensive experience in social development in Africa prior to her UN post. Sister Veronica?
Good morning to you all, and I'm happy to be with you. As I share this context of our webinar today, you will be seeing a few images of some of the programs of the people who responded to our survey, because we thought this would give you a slight visual. 2 years ago, the Grassroots Taskforce of the NGO Committee for Social Development set out to explore people's lived experience of inequality at the local grassroots level, with the view to seeing whether the situation had improved since the adoption of Agenda 2030 and the Sustainable Development Goals in 2015. So we designed a survey and circulated it to the members, through the members of our NGO Committee for Social Development, members whose networks extend around the globe and whose advocacy is rooted in grassroots experiences. Responses were received from 208 respondents in 48 countries, and you can see that on the rough map, covering all continents. They were submitted either electronically in SurveyMonkey or by email in one of 6 languages used. And today we're just using the 2 that were used with greatest frequency, English and Spanish. The results were analyzed and findings were shared in a preliminary format and then in a formal report that was launched virtually at a webinar following the Commission on Social Development earlier this year. The findings confirmed the fact that not only is poverty, but also inequality is multi-dimensional, involving numerous intersecting and mutually reinforcing disparities, deprivations, and forms of exclusion that go far beyond the traditional measures of wealth and income inequality. 4 years after the adoption of the SDGs, inequalities were found to be prevalent in responses from countries of all income levels, from rural and urban contexts, but with women and children suffering the most, as identified by our respondents, as well as groups such as minorities, migrants, homeless people, youth, and people living in poverty. Existing inequalities were also exacerbated in the contexts that were marred by the unique circumstances of political violence, conflict, and natural disasters, and sometimes a combination of the 3, with severe consequences for people who were already vulnerable. Disparities in access to healthcare, as Lynn has already made a reference to, was actually the second most frequently mentioned dimension of inequality after income wealth. Whether in high income, middle income, or low income countries, rural or urban contexts. It was spelled out in descriptive, qualitative responses and often in detail. This focus on inequalities in healthcare is noteworthy, given that the respondents were describing the situation 7 months before the onset of the COVID-19 pandemic, which has been, as was noted, widely seen as exacerbating pre-existing inequalities and vulnerabilities. While some progress and improvements were identified by respondents, this was most frequently the case in the lower income countries, in programs and services that were somehow directly related to the Millennium Development Goals. Services such as primary education, things such as infant mortality, maternal mortality, had gone down. Services and inequalities not addressed in the MDGs, such as housing and jobs, were frequently seen to have worsened, especially and notably in higher income countries. Although the awareness of rights, political literacy, and some gains in gender equality were acknowledged, it was noted that these gains can, and in some cases, had already been reversed following a change in government. And this was particularly concerning in the relation to policies concerning social protection, deemed by our respondents to be of major importance. Lags in the implementation of the Sustainable Development Goals, as well as the recent nature of some programs and policies, meant there was limited evidence of the real impact of the SDGs. NGO-sponsored programs and policies were generally judged to be more effective than government-sponsored programs, although somewhat complementary. Good practices were cited, and their success was often explained by the importance that NGOs placed on raising community awareness of political, economic, and social rights, as well as the use of participatory approaches that engaged people on the ground directly in decision-making on issues impacting them at the local and grassroots level. So this is just a brief snapshot of some of the survey findings in the context before the COVID pandemic, a context which we now hear the testimony of survey respondents 16 months into the COVID pandemic. So I hand it back to you, Lynn. Thank you.
Thank you very much, Veronica. That was very helpful. And I think everybody always enjoys a visual picture. Before I continue, I just wanted to acknowledge we had a planning group of 4 people who put this program together, along with Sister Veronica and myself. Despina Malaki, whose name you see on the screen, she will be handling the question and answer. And Barbara Bozak, who was from the Congregation of St. Joseph's. She's with us as a participant today, but she was intimately involved in the planning of the session. So I wanted to acknowledge their enormous contributions. Our first program that we'll hear from today is Water for Cambodia. And several of the photos that were shown in the slideshow were actually from that project. So you've already had a little bit of an introduction. I also want to note that our colleagues from Water for Cambodia will have to leave the program early. Hopefully they will still be with us at the beginning of the question and answer, but that's not for sure. This is because they are very much affected right now in Cambodia by the COVID pandemic, and the governor of their province has put in a curfew, and they will have to leave in order to be home before the curfew sets in. So I just wanted to let you know that. We have actually 3 speakers from the staff who will be presenting for the program. Massimo Mayo is Director of Operations. He's been with Water for Cambodia for about 6 years. And prior to stepping in as director following the very tragic loss of the previous director, he was responsible for expanding the water testing lab. That's an essential part of the program. He's joined by 2 additional staff members, Sopal San, who's been at Water for Cambodia for 2 years, and Sovan Sin, who is a community mobilizer, and he's been at Water for Cambodia for about 10 years. So together they will tell you a little bit about inequalities in Cambodia and the impact of COVID. Team, It's all yours. Please unmute.
Wow. So officially, good morning, everyone, and thank you for having us in this virtual around the table. My name, as Lini just said, is Massimo Maio, and I'm a director of Water for Cambodia. Just 2 words on our NGO that started operations in Cambodia in 2006. And mainly our mission here is to improve access to clean water, mainly delivering water filters, bios and filter, exactly, and latrines in villages of the rural areas here in the province, but not only. So no need to say that clean water and sanitation services are critical to stopping the spread and lower the impact of this pandemic. Ensuring people have water in their homes help keep people safe and help reduce time spent fetching water, being sick and caring for sick family members, especially by women and girls, enabling them to spend more time in education, working or growing vegetables to increase their incomes, improved wash, reduced poverty, and improves health, livelihood, and education. Same as in other countries, COVID-19 outbreaks resulted in a dramatic outlook for the Cambodian economy. Now, we would like to focus on the key areas where COVID has impacted our community and possibly increased the situation of inequalities. The point are the vaccination plan in place here, livelihood, education, and girls and women. Let's
Yes, nice to meet all of you. Right now, I'm responding about vaccination plan. The number of COVID-19 cases have risen dramatically since February 2021. At the moment, we have a total of more than 54,000 cases and 720 official deaths. Around 40% of targeted population have received at least the first vaccination. This is one of the highest percentages of vaccinations within the Asian countries region. Thanks to that, more than 3 million people are fully vaccinated with second doses. Around 1,460,000 of them are women. The vaccinations are mainly happening in the capital Phnom Penh and not yet in the other provinces or rural areas. Priority, we have been given governmental authority and not necessary to the biggest part of the population. Also, employees of local NGOs are not yet considered as a priority in the vaccination list. At the moment, we are having outbreaks mainly in rural villages. They are mostly related to imported cases from immigrants returning from Thailand. In the meantime, vaccines are also offered in hospitals in Phnom Penh to whom is able to pay a price between $200 and $600 per dose. To everyone is able to pay the fee. The rural population are not able to pay the fee, make them more vulnerable. Please listen to Mr. Sapal.
Good morning, everyone. Thank you so much for giving me to do a presentation today. Now I do a presentation on livelihood, education, girls and women. The pandemic had serious consequences for livelihood and poverty, causing the greatest threat to Cambodia development in its 30 years of modern history. The economic slowdown has resulted in a reduction of income from all sources, particularly in rural households. Poor households are mostly living in the rural area, where 80% of Cambodians lie. Households have responded to the drop in income by reducing their food and non-food consumption and by borrowing money. These coping strategies cannot be sustained forever and are likely to increase poverty. Unemployment rate has also been increased. About 500,000 jobs have been lost. Moreover, about 100,000 migrant workers have returned home and have lost their job. Informal employees and agricultural workers are more vulnerable to impact of the shock as they lack employment protection and health insurance. Families in Siem Reap province that rely on the travel tourism came to a total halt at the start of the pandemic in March 2020. Many families that rely on this livelihood now have little or no income. In Siem Reap, Cambodia, 45% already live under the poverty line on $1.90 a day, and the poorest 20% live in remote area with limited access to basic service such as. In order to get access to online education, students need access to a stable internet connection and technological device. These requirements have broadened inequality gap among students in rural and urban areas. It has also affected students with disability in getting equal access to education due to the lack of disability support program and facility at home. Economic hardship means families must take choice between sending their children to school or paid work. Domestic violence has also been increased. It happened especially in rural households because of the fear about the virus. Girls have been kept at home to help with chores and work. Now I give the time to Mr. Massimo to do a conclusion.
Thank you so much. So, since the beginning of the pandemic of March 2020, we have provided almost 1,600 biosensor filters, exactly 1,593, 162 latrines and 12 wells operating in 56 different villages of these provinces, all clearly in rural areas. During this time, we have also provided more than 400 hours of hygiene training to more than 18,000 people. This because the simple act of washing hands with soap came under the spotlight in 2020 as one of the best defenses against COVID-19. This is why our biosensor filter distribution always begins with a conversation about COVID-19 awareness and hygiene information and hygiene on physical distancing, not only for general health, but also to help prevent the virus escalating further. Since when this emergency started, we trained all of our staff on COVID-19 prevention, created internal preventive protocols, including social distancing and washing, mask wearing, and fever measurement. We also provided our staff with sanitizer and mask and started measuring temperature upon coming to work. And we applied clearly the same protocols also with all the local partners and teams working in their field. Biosensor filter distribution is also conducted with adequate social distancing. And what else to say? Moving forward, our plan is to offer an increasing number of hygiene training because they are really key for us, and we can see we keep reinforcing this training, other than adding more latrines to our project, so to fight one of the main problems we have that is related to the open defecation phenomenon, which is directly the first cause of bacterial contamination in local water sources. We all strongly hope that this will make the difference. Thank you.
Thank you so much to the team from Cambodia. I think you've demonstrated the wide-ranging and probably sadly long-lasting impacts of the pandemic that cut across not just the health dimension, but education, worsening the situation of women and girls, and the impact on the work of NGOs themselves. So thank you so much.
Lynn, I'm sorry for interrupting. It seems that the Spanish translation has an issue. Can I ask Tony, please, to take over because I can't see Marina? Thank you.
Okay.
Please, Marina, try to join in, sign off and sign in again.
Thank you, Despina. Sorry, apologies to our Spanish listeners. Next, we will hear from the Caribou Association that is based in Spain. And our speaker will be Nicole Ngala. Nicole was born in the Democratic Republic of Congo. She is now working in Spain and is Director General of the Caribou Association. This association serves migrants from Africa who are living in Spain. I think interestingly, Nicole indicates that she's very conscious of being one of the women of reference for the African community in Spain. She's active in a number of associations and advisory boards that create opportunities for young women and promote knowledge and trust between Spain and Africa. Nicole, please unmute yourself, and we look forward to hearing more about the situation in Spain.
Pues muy buenas tardes a todos. Mi inglés no es tan fluido, voy a hablar en español. Creo que hay un problema de traducción. Me llamo Nicole Ndongala, soy la directora de la asociación Caribou. Es una asociación que lleva trabajando desde 1991. Este año estamos celebrando el 30 aniversario. Trabajamos con la población de migrantes africanos subsaharianos con situación de vulnerabilidad aquí en España. Intentamos trabajar activamente para la lucha para conseguir la transformación.
Apologies, please. Can you give us 1 minute because there is an issue with translation now. We can't even hear the English one. So okay. I'm going to have to ask our two interpreters to try and do their best to sign in again.
Okay, yes.
Just give me 1 minute, Nicole. Thank you so much. And apologies everyone for this technicalities, difficulties. I see Tony is signing in. Yes, Tony.
Tony, you're good. I'm just waiting for Marina to come back.
Yes, Tony, no problem. Thank you. Thank you so much. Let's wait just 1 more minute for Marina to sign in as well.
Yes, can
Marina,
you hear me?
are you there?
Yes, I'm here. Can you hear me?
Yes, thank you so much. So
okay.
Please, Nicole, go ahead and continue your presentation. Again, I'm really sorry for the interruption.
De acuerdo. Decía que me llamo Nicole Ndongala, soy de la República Democrática del Congo, soy la directora de la Asociación Caribú, Amigos de los Pueblos Africanos. Es una asociación que lleva trabajando desde 1991. Trabajamos en dos ámbitos principales, que es la ayuda humanitaria y la integración de la población vulnerable aquí en España. Intentamos activamente trabajar por la lucha, para conseguir la lucha en el cambio de la transformación social, para así contribuir en una mirada desde la interseccionalidad, para poder dar también oportunidad a las personas inmigrantes que llega aquí en el territorio español. Es verdad que desde 2019 que la pandemia afectó de una manera global a la población mundial, desde Caribú hemos tenido que reinventarnos, dirigir nuestra mirada hacia un trabajo más humanitario todavía de lo que hacíamos. Es verdad que la población africana para nosotros nos cogió un poco de sorpresa esta pandemia. España no estaba preparada para poder dar respuesta o una solución a todas las personas inmigrantes, entre el tema de idioma, cierre de centros y el tema de alimentación. Desde Caribú, pues tuvimos que tener allí lo que es registrar un poco las personas que tenemos que estaban en situación de calle, para ver qué respuesta podíamos dar a esas personas y las personas que tenemos en los pisos, porque Caribú tiene bastantes servicios, tanto sanitario, el tema de alojamiento y también el tema de comida. Hemos acercado comida a las familias que necesitaban comida, sobre todo al principio, y luego hacer entender a las personas qué es lo que significaba, qué es lo que implicaba esta enfermedad COVID, qué medida tenía que tomar. Si hay que hablar de cómo afrontaron las personas migrantes africanas esta situación de COVID, tenemos que decir que la resiliencia en el mundo africano existe, porque África es un continente plegado de situaciones difíciles, por lo tanto, la ampliación de los problemas que viven los africanos le lleva a tener una resiliencia bastante fuerte. No significa que el hecho de ser resiliente no hay dolor, no sufre uno, pero hay una manera de poder afrontar ese miedo, cambiar la incertidumbre a la certeza, porque era la manera correcta de poder llevar todo este tema del COVID-19. También hay muchas familias que no tenían la posibilidad de poder tener herramientas suficientes para poder seguir con su integración. Hemos acercado a familias que necesitaban datos de internet para poder continuar con la brecha educativa, para poder continuar con la formación. Los enfermos crónicos, desde el servicio sanitario de la asociación, les hemos acercado los medicamentos, porque también el hecho de ser migrante en el tiempo de COVID aquí en Europa, en especial en España, ha supuesto mucho problema para las personas migrantes. El miedo a salir en la calle porque no tiene documentación, porque la mayoría también trabaja en los trabajos informales, tuvieron que perder sus trabajos durante el confinamiento, y los pocos que tenían trabajo eran trabajos arriesgados, pero aún así siguieron en la calle por miedo a perder sus trabajos. Siempre hemos estado ahí durante el confinamiento para poder apoyar todas esas personas. Debemos de resaltar también la solidaridad del pueblo español que hubo durante la pandemia, sobre todo los jóvenes, porque en Caribú somos 7 contratados, pero hay como 300 voluntarios. Y es un porcentaje muy alto de las personas con vulnerabilidad, que eran personas mayores. Aunque la población africana no ha tenido que lamentar muertos por COVID-19, pero sí que hubo bastante problema al tema de salud mental, porque al perder sus trabajos y las personas también que tienen trabajo de venta ambulante, esas personas no podían salir en la calle para poder vender. Y las personas que trabajaban en casa, sí o sí, tenía que ir a trabajar por miedo a perder el empleo. Eso también ha supuesto la debilidad de la salud mental de muchas personas en ese sentido. Yo creo que lo que sí que se reclamó muchísimo durante la pandemia, que la humanidad existe, porque sí tenemos que hablar de los objetivos de desarrollo sostenible. Yo creo que la igualdad en el mundo de los inmigrantes existió muchísimo durante la pandemia, aunque hay esa brújula, ¿no?, que siempre nos guía para poder solucionar los problemas con esperanza, pero durante la pandemia se notó muchísimo y se pidió al gobierno, sobre todo, de poder regularizar la situación de los indocumentados, porque no se podía vivir dentro de la incertidumbre de la enfermedad, pero al mismo tiempo dentro de la incertidumbre de poder ser deportada en tu país de origen, porque ahí también era un problema que habíamos trabajado muchísimo durante la pandemia. Yo creo que aquí esta pandemia nos ha dejado un mensaje muy claro. El mundo se ha visto debilitado, pero en un minuto, de las cosas que se pensaba tocaba a los países en vía de desarrollo, pero durante la pandemia vimos cómo el mundo, la fragilidad del mundo existió, porque ahí sí que hemos visto que el mundo es frágil, no depende solamente de un continente o de otro, sino es cosa de todo. Ahora con el tema de la globalización estamos intentando que haya una cooperación, porque si no hay cooperación, vamos viendo cómo no vamos a cumplir con los objetivos del desarrollo sostenible. Porque si, digamos, se debilita un país, se ve cómo se puede debilitar el mundo entero. Porque esa enfermedad empezó en un país, se ha ido expandiendo a todos los países. Yo creo que todos hemos vivido el miedo, pero de una forma muy especial a un colectivo vulnerable, que era tanto las personas migrantes y también las mujeres, porque la situación de algunas mujeres que vivían en espacios muy pequeños, esas personas tuvieron que convivir con sus agresores. Por lo tanto, ahí también estamos viendo que la desigualdad no solamente fue al nivel de los inmigrantes, pero sino en especial al nivel de las mujeres. Convivieron con sus agresores y no tenía voz y no tenía dónde acudir para poder denunciar. Tanto aquí hemos visto cómo hay muchas mujeres que se han quedado embarazadas para las personas que la han tenido que alojar en sus casas durante la pandemia, y son las consecuencias. También las que estaban en el camino durante la pandemia, no había periodista que le controlaba, que vigilaba qué es lo que pasaba realmente con esas mujeres, si le faltaba agua, si necesitaba compresa. Durante el camino, durante la pandemia, no había nadie que acompañaba a todas esas personas. Por lo tanto, todo eso está haciendo que esas personas que llegan ahora trae consigo una situación mental bastante fuerte. Entonces, se encuentra también que el tema de salud reproductiva aquí en España no abre la puerta a todas las personas que tienen la situación de irregularidad. Solamente es a un grupo de personas que tiene documentación. Por lo tanto, estamos hablando, ese se está arrastrando, esa mochila del sueño que tenía esos inmigrantes, cada vez se cae y son personas que se hunden. Por lo tanto, psicológicamente estamos hablando, la situación no está ayudando, no está apoyando a esas personas. A nivel global, yo creo que tenemos que llegar a unos retos que tienen que ser por el bien común. El individualismo tiene que acabar y es un mensaje que tenemos que saber que si queremos ese crecimiento, que llegamos a los objetivos principales que nos hemos puesto para 2030, tenemos que trabajar desde la cooperación para el crecimiento, no solamente personal, sino también colectivo. Para ir acabando, porque no hay mucho tiempo, yo el mensaje claro que quería decir, que esta COVID está suponiendo un reto para, no solamente para el sistema sanitario en el mundo entero, pero sino también es una prueba para la humanidad en común. Ahí hay que abrir la puerta a todo el mundo para que la persona crezca de una forma, con una dignidad honesta, porque si no volveremos a retroceder, no vamos a conseguir los objetivos del desarrollo sostenible. Desde aquí, pues dar la enhorabuena para esa iniciativa, para escuchar las voces de todo el mundo. Nosotros vamos a continuar estar allí, a trabajar y a luchar para que se consiga, que se siga respetando a las personas, porque al final la dignidad de las personas sí importa. Mientras que se decía, quédate en casa, nosotros desde Caribú hemos dicho, yo me quedo contigo, porque la vida humana sí que importa. Gracias.
Thank you so much, Nicole. You brought a lot of new dimensions into our discussion, and I particularly note the emphasis on the plight of refugees and migrants. And that's actually part of Goal 10 as well on inequality. I feel that the targets that are set around migration are the weakest targets in terms of really being measurable and being able to hold the international community as well as governments accountable. So I really appreciate your bringing the plight of special plight of migrants and refugees into this conversation, as well as the cooperation among countries. So hopefully we can get back to some of these points in our discussion. Again, thank you. Now we are going to move to Canada. We really are moving around the world here. Here we are in our third continent already. And in Canada, we are going to hear from the Antigonish Women's Resource Center. Jubanti Topo is the community development professional who has 10 years of experience in the nonprofit sector in Canada and internationally. Most recently, she worked with the Antigonish Women's Resource Center and Sexual Assault Service Association, helping people from different backgrounds, including immigrants and refugees, through various settlement and integration programs. I think it's also of note that in 2019, Jubanti represented Canada as well as one of the Canadian delegates to the 63rd session of the United Nations Commission on the Status of Women. Jubanti, please unmute yourself and take over the program for now.
Thank you, Lynn, for the introduction. I will quickly share my screen. Okay, I think I'm unable to share my screen.
Despina, do you have the capability to allow Jubanti to share?
I'm doing it right away, Lynn. Hold on a second.
Sure, thank you.
Could you please try now, Jubanti?
Sure. Yeah, thank you.
Thank you.
So once again, thank you, Lynn, for this very kind introduction. Good morning, good afternoon, and good evening, everybody. My name is Jubanti Topo, and today I will be presenting on the topic, inequalities in the grassroots and the effect of COVID-19 pandemic. Before I begin, I would like to acknowledge that I am joining from the Mi'kmaq, and this presentation is delivered from the traditional, ancestral, and unceded territory of the Mi'kmaq people. I would also like to take this opportunity to inform you that I lost my father last week, late Joseph Dunn, and he was a strong advocate for social justice for everyone, and therefore this presentation is dedicated to him. So prior to implementing the SDG10 in the grassroots, which is before the pandemic, immigrants, refugee population, and people of color experienced extreme poverty in rural communities. They also experienced issues of food security, where people were not able to afford nutritious food, which resulted in sicknesses and diseases of various kinds. There was also increased housing needs, and due to this, they had difficulty paying their rent, and there was reduced wages. There was issues of lack of childcare and daycare provisions. Due to the lack of livable income, people could not afford childcare and daycare provisions. There was lack of access to services due to transportation needs and ineligibility and language barriers by the immigrant and refugee population. There was also lack of access to information. Immigrants, refugees, and people of color experienced racism and discrimination a great deal at workplaces, healthcare sectors, education sector, due to prejudice, stereotypes, and ignorance. They also experienced issues of social isolation, as they did not feel a sense of belonging, in particular for seniors and people with disabilities. And this resulted in increased mental health problems. After implementing the SDG10 in the rural communities, we had programs around affordable housing initiated by various groups in the local community. There were community groups who initiated programs such as Affordable Housing Society. Although it was mainly for locals and not necessarily for immigrants and refugees, their initiative had a positive influence on many local groups and community-based organizations who directly work with immigrants, refugees, and people of color. There were also groups who introduced programs such as a Roof Over Your Head program, which looked into providing shelter as well as the overall well-being of the people. Also, community groups collaborating with the government programs such as the Eastern Mainland Housing, which provided subsidized rent to low-income families, supported the immigrant population in the rural communities. Local food security activities were initiated by various groups, such as community gardens were initiated, food bank initiatives. Various churches initiated programs such as hot meal programs to support people with low income. Education and awareness around topics of financial literacy, employment, how to start their own businesses, entrepreneurships. Initiatives towards diversity, equity, and inclusion was also initiated, such as cultural competency trainings, unity in diversity walk to raise awareness around racism and discrimination. Cross-cultural workshops took place, potlucks to integrate the local community with the immigrant population, International Women's Day celebrations, etc. Also, family and early childhood provisions were initiated. Childcare facilities by community-based organizations to enable families attend trainings. Collaboration of sponsor groups who sponsor refugee families with early childhood organizations. Inequalities experienced during the pandemic. Many immigrants, refugees, and people of color struggled to meet basic needs in the rural communities, such as buying groceries, paying their rent, buying basic necessities. There was increased problem of food security, education, and employment. There was reduced access to sustainable housing. Due to the increase or hike in the rent, people were not able to afford the price of the houses. They had difficulty becoming homeowners in the rural communities due to low income and not being eligible to obtain government provisions. Social isolation and mental health crisis increased. There was rampant experiences of racism and discrimination at workplaces, healthcare sectors, educational sectors, and in the community. Selfish corporate agendas and lack of accountability by the government and local community. Many businesses and employers took advantage of the pandemic situation and recruited immigrants, refugees, and people of color by paying significantly reduced wages. For example, in agriculture sector, food processing sector, caregiving sector, and retail. There was increased physical, sexual, and mental and emotional abuse. Due to lack of access to services, there was increase in physical, sexual, and mental abuse within families, and these issues went undocumented during the pandemic. Employers abused temporary foreign workers as they did not have a permanent status. And immigrants, refugees, people of color had issues of lack of access to services. Just to give you a brief overview of the statistical data during the COVID-19 pandemic, 17% have temporarily lost their primary source of income. 1 in 5 have trouble affording housing expenses. 1 in 3 international students is having trouble affording housing expenses. 1 in 10 is having difficulty affording essentials like groceries, rent, and prescription medications. 48% have lost their jobs or pay, or experience reduced hours, or have reported receiving Canada Emergency Response Benefit or employment insurance. 27% were unaware of benefits due to lack of information. 19% of permanent residents had contacted a social service agency for aid. 12% wanted but did not know how to navigate the services. 48% of international students and 43% of temporary foreign workers were not eligible for services as eligibility criteria restrict their access. Also, indigenous, Black population and people of African descent were disproportionately affected, along with the immigrants and refugees. Resilient recovery post-COVID-19 and what we need to do moving forward. Family and social support systems need to be created. Community-based organizations, local community groups, and government must support the immigrant, refugees, and people of color through support groups, healing circles, trauma therapy, to revive and recover from the effect of the pandemic. Community-based organizations can assign support groups, support workers, especially for this population. Training and development opportunities must be organized to rebuild lives, such as helping immigrants and refugees build their language skills, entrepreneurship skills, and how to navigate government provisions. Improved government provisions around education, healthcare, and housing needs to be addressed. Mental health provisions and first voice interventions need to be looked at, keeping in mind the diversity in culture. Employment provisions for equity-seeking groups, community-based organizations, as well as private and public sectors must have designated positions for immigrants, refugees, and people of color to provide them decent jobs and help them regain their income and quality of life. Better immigration policies and procedures, which will qualify temporary foreign workers, international students, access government provisions. Provisions for access to information and services. Government must make an effort to design policies geared toward the rural community and not model policies that are designed for urban-centered in the rural communities. So this is the end of my presentation. Thank you for listening.
Thank you very much, Javanti. I really appreciate that you put a spotlight on mental health as a dimension of the impact of the pandemic, because I think for many of our people, we're facing so many basic survival issues. I don't know if everybody else is hearing this. I'm hearing a talking over with the interpretation all of a sudden. Hopefully that will be fixed. But I think the importance of mental health shouldn't be be understated, even though we know people are facing basic survival issues in terms of food and shelter. But the isolation has been really difficult across the age span, I think, for so many people. We have one more program. We are now going to South America, to Colombia, and we will hear from Sister Gloria Edith Munoz Rodriguez. She is a daughter of Charity of the St. Vincent de Paul, and has worked out with the Casa Divina Providencio Pasta, in which I'm probably murdering the name of it, in Cali, Colombia. She's a lawyer who specializes in social management. The organization that she was with when she responded to our survey provided shelter for women, including pregnant women, nursing mothers, and victims of any form of violence. She's moved on and currently coordinates a university residence for young rural women. Sister Gloria.
Muy buenos días, muchas gracias por la invitación. Un saludo fraterno para todas las personas que están participando en este evento. Sí, mi nombre es Sor Gloria Edith Muñoz, soy hija de la Caridad de San Vicente de Paúl, de la provincia de Cali. Actualmente soy la coordinadora de la residencia universitaria para jóvenes campesinas en la ciudad de Pereira. Buscamos la promoción y ayudarlas para que ellas puedan continuar y tengan unas mejores formas laborales. Cuando contesté la encuesta en el 2019, me encontraba coordinando la casa de acogida para mujeres, madres gestantes y lactantes, procedentes de la costa pacífica nariñense especialmente, una región muy afectada por el narcotráfico y por el conflicto armado en Colombia, y también para la atención de víctimas por desplazamiento, desaparición forzada y víctimas de violencia sexual en el marco del conflicto armado en Colombia. Lo primero que quiero manifestar es que en todos los departamentos de Colombia no han sido afectadas por la pandemia de la misma manera. Algunos departamentos, por su responsabilidad social, de las empresas, por la solvencia económica de muchas personas, se despertó una gran solidaridad y pudieron atender a las personas más vulnerables. Me referiré en esta ocasión a las realidades y consecuencias en el departamento de Nariño, donde está ubicada la Fundación Casa de la Divina Providencia. El departamento de Nariño queda al sur de Colombia y es frontera con Ecuador. Por lo tanto, el paso de migrantes venezolanos y también zona central para recibir muchos desplazados por el conflicto armado. Este departamento es corredor y principal productor de cultivos ilícitos en Colombia, con fuerte presencia de grupos al margen de la ley, disidencias de las FARC, ELN, grupos paramilitares, y especialmente en las zonas rurales y en la costa pacífica de Nariño. La comunidad mayoritariamente es afrocolombiana e indígena. En este momento, en esta zona se está viviendo una situación muy difícil. Lamentablemente existen muchos enfrentamientos. No podemos hablar que Colombia se encuentra en esta región en un posconflicto, sino que al contrario, hay un conflicto muy fuerte. Los desplazamientos, y en este tiempo de pandemia, más de 5.000 personas se han tenido que desplazar desde sus veredas hasta las cabeceras municipales. Son municipios muy pobres. Por tal razón, es difícil que se puedan estar durante mucho tiempo porque no tienen alimentación, no tienen pues el hospedaje. Es difícil. Con muchas organizaciones pues se trata de ayudar y solventar un poco la parte alimentaria, pero la parte alimentaria, la parte de vestido, entre otras necesidades básicas que ellos necesitan, pero es bastante difícil porque son muchas personas desplazadas. Por eso hablamos de unos desplazamientos de todo un territorio, están más o menos 2, 3, 4 semanas y otra vez tienen que regresar nuevamente cuando ya los enfrentamientos han cesado un poco. El sistema de salud en esta zona es muy precario y más en este tiempo. estamos en alerta roja por causa del COVID-19, por lo tanto es desbordante y no hay todas las medidas de seguridad, de bioseguridad y también la asistencia que estos territorios necesitan. Voy a compartirles ahora cómo ha impactado la vida de las mujeres, tanto el COVID-19 y el conflicto armado, y hoy en Colombia lo del paro. En esta zona, especialmente las mujeres que se han atendido o los grupos que se han atendido dentro de la Fundación Casa Divina Providencia. Con respecto a los grupos de víctimas, tanto de desaparición forzada, violencia sexual, desplazamientos forzados, lo primero que debo decirles es que antes de la pandemia, la mayoría de estas mujeres obtenían sus recursos de ventas informales, especialmente de comida y también de trabajos en oficios domésticos. Cuando se dictan las medidas por el gobierno nacional del confinamiento, ellas se ven obligadas a encerrarse, pero sin recurso alguno. Entonces fue una situación muy difícil para ellas, no tuvieron más empleo. ¿Y cómo sobrevivieron? Sería la gran pregunta. Solo algunas fueron beneficiadas por ayudas del gobierno, pero eran ayudas muy pequeñas porque es una población muy inmensa. Por lo tanto, desde la fundación se les apoyaba con paquetes alimentarios y también entre ellas mismas, o sea, la solidaridad y más por el sufrimiento que han vivido, no solo por la pandemia, sino como víctimas y sobre todo por todos los desplazamientos que ellas han vivido, pues su capacidad de resiliencia es muy grande. Se han tenido que emplear y ahora en este momento que todavía estamos en un pico muy alto, el nivel de contagios en Colombia es muy alto en este momento todavía. Sin embargo, ellas, ante la flexibilidad de las medidas por parte del gobierno, ya han empezado nuevamente a salir, pero sus ingresos ya no es lo mismo. La gente tiene temor de comprar lo que ellas pueden vender en la calle y han tenido que cambiar sus formas de ventas. Es una situación bastante difícil.
Lynn, we lost Gloria.
Yes, I'm afraid Gloria has frozen here. Let's just give her 1 minute, see if she comes back. Otherwise, we will proceed with a question or two and come back. Oops. 8:35. She's left. Maybe she's trying to sign in again.
Just give it maybe 1 minute and
Yeah, here she's signed in again. Gloria, can you hear us?
Me he desconectado, ya voy a retomar. La mayoría, les estaba comentando que para la mayoría de las víctimas, la virtualidad ha representado una nueva forma de exclusión, ya que para ellas se les dificulta mucho el manejo de las plataformas virtuales, de algunas páginas web, para poder realizar sus procesos de reparación e indemnización. Se quejan de que los teléfonos que pues no contesta nadie, no tienen a quién pedirle alguna información. Hoy más que nunca se sienten solas y desprotegidas o deben pagar para que alguien les haga estos procesos y ellas no tienen. De hecho, la pandemia las ha llevado a endeudarse aún mucho más porque al principio de la pandemia no tenían cómo pagar sus arrendamientos y pues se han tenido que endeudar. Entonces no tienen tampoco cómo pagar quien les oriente en estas nuevas formas. Bueno, con respecto, ¿qué ha hecho la Fundación para acompañarlas en este momento? A estas víctimas se las está atendiendo de manera personalizada con todos los protocolos de bioseguridad. También se les está asistiendo en visita domiciliaria, mirando sus realidades, sus condiciones de vida, para poder priorizar las necesidades de ellas. Ahora quiero contarles un poco con respecto a las mujeres atendidas en el hogar que procedían de la costa pacífica de Colombia, la mayoría de ellas afrocolombianas e indígenas. Muy al principio de la pandemia, el hospital infantil se presentaron varios contagios de los bebés por COVID-19, por lo tanto se tenían que quedar ya o en su territorio o en la casa. Entonces se quedaron en nuestra casa de acogida hasta que se tuvo que cerrar y solamente continuar con las mamás que estaban en su momento, porque Pasto es una ciudad muy fría, entonces no hay una ventilación tan buena pues para poderlas ayudar, y pues por los contagios no se podía poner en riesgo la vida de las mujeres. Tuvimos que cambiar un poco el programa y se creó un programa que se llama Llegamos hasta tu casa. Lo que se hizo fue que empezara a gestionar kits alimentarios de aseo y también para la mamá, para el bebé, y hacerlos llegar hasta la costa pacífica de Nariño a las madres que más lo necesitaban, y también con algunas de la ciudad de Pasto que también estaban en una situación demasiado precaria, y se atendieron también bastantes mujeres migrantes venezolanas para quienes fue también muy difícil esta situación de la pandemia porque estaban prácticamente en un estado de mendicidad. Para ellas también se llegó con este nuevo programa, Llegamos hasta tu casa. Hasta el momento se siguen atendiendo de esta manera a las mamás. Se está abriendo nuevamente de manera muy poca para que ellas puedan seguir atendiendo. También se abrió nuevamente el comedor para el adulto mayor, para quienes también ha sido una situación muy difícil, porque ellos tampoco tienen ni siquiera la fuerza para preparar sus alimentos. Entonces vimos que era una necesidad muy grande. Se están dando otra vez la alimentación por grupos de 20 adultos mayores, y con las víctimas de todas formas de violencia, las diferentes organizaciones, con ellas también se les apoya en la parte especialmente alimentarias, y estamos buscando juntos las nuevas formas para poderlos ayudar en la parte laboral, que es la parte que más se ha visto afectada. Obviamente también ellos siguen reclamando al Estado desde hace mucho tiempo, y ahora con mayor razón, sus procesos de reparación, sus procesos de justicia, sus procesos de verdad y sobre todo de sanación, porque son mujeres muy resilientes y tienen en su corazón el deseo de seguir luchando, de seguir adelante, porque aman la vida y defienden la vida. Muchas gracias.
Thank you very much. That was a very dramatic way, right at the point you were talking about access to the internet. You managed to lose your connection. I think you really underscored the importance of the internet and what we've been doing in the pandemic. Again, I'm hearing the talking over of the translation, if that can be fixed. Thanks to all our panelists. You've certainly raised a number of points, and a lot of them do flow back to the survey that Sister Veronica talked about in the beginning. And we had made a series of recommendations out of our study, and a lot of the issues that we highlighted have only been intensified by the impact of the pandemic, such as paying attention to the most vulnerable, especially in terms of disaster planning. And I think we now have to include the idea of a pandemic in our definition of what is a disaster. And Sister Gloria, you definitely also brought in the issue of conflict and the continuing impact of violence in terms of the impact on inequalities. We have a couple of questions in the chat, and one of them I think related to advocacy. Despina, maybe you could read that and we could see if Massimo wanted to say anything about that before. I know he has to run home to avoid the curfew.
Yes, thank you. Yes, we have one question. Our first question comes from Emily, and she would like to hear more on the grassroots advocacy efforts towards decision makers at local, national, or regional level, and what are the learnings from these efforts? As Lynn said, I would like to ask Massimo to address this one since he's having the time restriction. Massimo, are you there?
Yeah, I'm here. Well, anyway, we took the decision. We took our risk. We're trying to stay as much as we can. So, sorry. So don't worry about us. Can you repeat what was the question?
The question is about the grassroots advocacy efforts towards decision makers at local, national, and regional levels, and what are the learnings from these efforts?
This is a very sensitive question for us, because one of the main problems we are experiencing here is the absence of any political choice made by the local government. In this country, the government is all focused on mainly on collecting as many vaccines as it can, and politically Cambodia in this very moment is an important historical moment, as Chinese are literally buying up the country. So all the questions related to the poor people and all the little communities, like the Vietnamese community, the Thai community, are literally let go away. No one is caring about that. So the only thing I can see now in Cambodia is about few NGOs still working here. Many of them are no more working at the moment, and there's a very little they can do. So that I'm afraid there's not a lot to be said on this here in Cambodia. And you know, let me be honest and frank. We are lucky that some of us are here operating, helping these people, but it seems that no one is really interested here in this kind of dynamics. I mean, we operate in a city, this is Siem Reap, that is in northern Cambodia. We have seen a progressive impoverishment of the people. The economy is being zeroed. All the rural areas were living on business of this town, but the town was living on tourism. So the moment the COVID started all around the world, this country has been literally left alone. And it doesn't exist, not even the idea of a serious plan on how to recover, because it seems like there are dynamics that cannot take into consideration this problem.
Thank you. I think sometimes perhaps advocacy has to be done from the outside in terms of the international community as well. I happen to be.
Lini, sorry to interrupt. It's important to say that even if people think Cambodia is not such a troubled country, in this country, working in international cooperation and operating on this soil, it can be difficult if you don't follow the direction of the local government. So it's easy to be excluded. So there are subjects that is better not to afford publicly, if you know what I mean. So that's why we don't see really any particular interest in this government in, as I read in a question, elaborate politics for decolonize the place or something like this, because Cambodia was working very well until 2 years ago. The economy was pushing very fast, and they had big investors coming mainly from China. And now everything is happening here. All the important choices by the government are about strengthening the ties with these governments around for receiving funds, and that is it.
Yes, thank you. We know that NGOs in many countries operate, have to tread carefully in terms of their variability to function and to survive. So what we might call advocacy in some parts of the world has to be thought of very differently in the local context. Does anybody else from one of the programs want to comment on this question before we move on? Okay, this doesn't seem so. Despina, do you want to acknowledge another question?
Yeah, sure. So we have a question from Sebastian. He asks Jubanti, I'm sorry, what exactly is being done in Canada to address and assist vulnerable Indigenous population?
Thank you for the question, Sebastian. There are a wide variety of programs that has been enacted by the government as well as community-based organizations. So talking from our organizational perspective, we have a project called the Circles of Support and Change Project at the Antigonish Women's Resource Center and Sexual Assault Service Association, wherein we work in partnership with 3 distinct rural underdeserved communities to develop community-led, community-based responses for preventing and responding to gender-based and sexual violence. Also, we have programs which is initiated by the government for families and children of the Indigenous community, which is called the Mi'kmaq Family and Children Service Center, wherein they try to support the children of the Mi'kmaq families, where they try to help them in integrating with the mainstream and supporting them with issues they may face within their families. And so the Mi'kmaq Family and Children Service System, they try to sort of separate the families for a short period of time, not with the intention of separating them permanently, but to help them rebuild their lives. But during that short period gap, there is no support system for the families to interact in a way that their family relationships are still intact. So that is a gap in the program of the Mi'kmaq Family and Children Service System. And therefore we are fighting for to fill in that gap as an organization. Also to address the housing needs, there are various programs initiated by the government. So the government recently announced the 10-year project called the National Housing Strategy, wherein we are trying to address some of the issues and concerns experienced by rural communities, especially the Indigenous population. Also, in December of 2020, the government introduced this program for the Black population, the people of African descent, because the African people have been struggling to have a sustainable housing, also the Indigenous, and become homeowners. So in December of 2020, the government announced a $40 million fund to address the housing needs and help enable the Indigenous and Black population to have sustainable housing needs met. So these are a few programs that comes to mind to help the Indigenous population in the rural communities in Canada.
Okay, thank you, Jumanti. Lynn, would you like to go to the next question? I know, Sebastian, you have also posted another question, but in terms of fairness, I will leave that at the end in order to give to other attendees as well the opportunity to to speak out. So I'm going to address a question regarding to the UN programs that you are aware of in your country, that you can connect or coordinate with in our 4 countries that we have here. So Lynn, anyone from the panel would like to address that question?
So do any of our panelists aware of or have experience with connecting with UN focused programs, UN sponsored programs? Gloria, I think you're muted, but are you trying to answer the question? I still see the mute button on your screen. Thank you. Good.
Gracias. Sí, algunos programas desde Naciones Unidas en Colombia sí ha habido un apoyo grande a las víctimas. De hecho, con ACNUR es lo que ellos siempre más cuentan en cuanto a, bueno, ayudas humanitarias desde la Cruz Roja Internacional también, en el acompañamiento a víctimas de desplazamiento forzado, en la asesoría para las mesas, que es donde se realiza toda la democracia participativa para poder escuchar a los grupos minoritarios y también a las víctimas, siempre está presente. Y también en muchos momentos, cuando se han realizado trabajos de reconocimiento, de reparación, la unidad de búsqueda, todo esto está precedida por algunos programas de Naciones Unidas. Y también hay en toda la zona pacífica de Colombia presencia de la ONU en todo este territorio, pues acompañando. Y igual es un conflicto y una zona bastante, o sea, con muchos conflictos fuertes. Por lo tanto, se hace pequeño todo lo que se puede hacer. Se necesita aún muchísima más ayuda, o sea, no es suficiente, pero sí hay presencia de la ONU sobre todo para los derechos humanos y en el proceso con víctimas.
I think the issue of support, international support, is also an important part of this, this agenda, because certainly the 2030 agenda calls for countries to step up and to increase the amount of international assistance they're offering. And instead, I believe what's happening in some places in the response to COVID-19 is that the wealthier countries are in fact cutting back on their foreign assistance. And I know that this is something that happened to Water for Cambodia, where they had been awarded a very competitive grant that was very difficult to, time consuming to prepare to the British government, and had been awarded the grant, and then were notified this spring that Britain was going to cut back its foreign aid program and cancel a number of their grants. So this again is directly contrary to the commitments made in the 2030 agenda. And although all countries have suffered economically, I think when I was talking about international advocacy, I mean pressure on the richer countries to live up to the commitments that they made and to, in fact, increase them. And we know instead what's happened is that they've been buying up the majority of the vaccines, and that there hasn't been this sense of equity and sharing. So, I do think that the issue of UN but also government commitments internationally are very important. Sorry, Despina, I didn't mean to occupy the microphone, but is there another question? We can
yes,
have a few more minutes.
Pertinent to the previous question about the UN programs, Marianne is asking the panelists, what do they think that are the most effective strategies that the UN can promote among and within their countries in order to reduce inequalities? Yes, Massimo.
Yeah, for instance, here in Cambodia, good news is the effort done for pushing people back to a better approach to agriculture. And I know there's a 5 years plan here from USAID, the United Nations, for making available lands and technologies for local people. This really is the only positive things I'm seeing in this part of Cambodia, because many families in villages, they were relying on the younger, or the young people going town to work in hotels and restaurants, which now are closed. And the only way for solving the matter is pushing back people working the land in the right way. This, to be honest, was already happening before COVID, but now is assuming really a different proportion, a greater importance. Honestly, the only things I see positive here is this new way to read the economy here, because in previous years in Cambodia has 3 big towns, and slowly people, all Cambodians, they were coagulating around the town, working in services and whatever. Now, one of the side effects of COVID, with the return of people to the villages, it could be educating them to proper use of land. And this can be done with the help of international cooperation, really, because it's a matter of not just of owning the land, but also to knowing the right technology on how to use it that is best. On the other side, the other face of the medal is that at the moment, more than 3 million Cambodians, they have loans that they are not able to repay. At first, they have been asking loans to the bank. The bank has been taking them the land. They have no more land, and they are referring to microfinance. And there's a huge debt that is being created around this that is not possible to solve. So even this bubble, sooner or later, will explode here.
Thank you. That's very sobering thought. Now, I noticed that it is, I believe, about 1 minute before 9 o'clock. And we have, and our Cambodians are violating the law. But it's a really good program, so I hope they don't get arrested on the way home. But I want to thank,
I'm very sorry to leave it now. It would be my pleasure to stay, but I have to.
Well, our time is up, so I think we have to. I believe we have to bring this to a close. I know there were some unanswered questions. As there always are when we talk about social development, there's many unanswered questions. I want to thank, I think that the panel has really shown not only the importance of Goal 10, but the integration of all of the interaction among the SDGs. We have talked about SDG 1, 2, 3, 4, 5, 6, 10, and I think probably 16 and 17 as well. And I may be missing a few because I think I left out the ones on agriculture. But this has been a very fruitful program. I really want to thank the 4 programs that presented for us today. You've given us a global picture of some serious problems at the grassroots level, but also some important efforts that are going on to help, to empower people, to bring people out of the pandemic and address the many issues that were dealt with. So I hope we all get to meet again, perhaps sometime in person as well as by Zoom. But I want to thank our interpreters. I want to thank Despina for managing the question and all of our technical problems. And I want to acknowledge Jillian D'Souza, who has an icon here. She is co-chair of the NGO Committee for Social Development and has provided a lot of guidance along the way for our efforts. The NGO Committee for Social Development is, we meet monthly where we welcome participants. The one benefit of COVID is that it has allowed us to become an international committee because people are joining us online. So I don't know, Despina, if you put the website in the chat, but it is in the chat. So if you go to our website, you can find the complete report of the survey that was mentioned and also updates about our activities and our meetings. So once again, I want to thank our participants who came to us from many parts of the world. I've seen, I took a glance at the participant list and I recognized people there from many parts of the world, from the Caribbean to Japan to Hong Kong. So this has been a very fruitful opportunity for me, and I hope for all of our listeners. So once again, thank you. And those addresses are in the chat.
Have a great night.
Thank you.
Bye, everyone.
A great day. For us, good night.
Bye, Veronica. Bye.
Bye-bye.
Bye.